DeGette for her 5 minutes of questions.
Thank you, Madam Chair. Mr. Secretary, I spend a lot of my time here on this committee promoting maternal and child health, and I'm proud to have worked alongside my friends Buddy Carter, Robin Kelly, and Kat Kamek in a bipartisan way to get the Preventing Maternal Deaths Reauthorization Act signed into law just this February. I think I speak for all four of us, as well as the bill's other champions, when I say we're very proud of this legislation and the work HHS did to implement the original Preventing Maternal Deaths Act, which was passed under the first Trump administration. So because of the data collected by the maternal mortality review committees, we know 80% of maternal deaths are preventable, and we can direct resources into saving those moms and keeping those families whole. I think you would agree that that is useful data to have, correct?
Yes, Madam Chairman.
Thanks. And work fostered by HHS has also helped reduce infections in newborns, reduce preterm births, improve treatment for mothers with substance use disorders, and much, much more, which is, again, much needed progress. Wouldn't you agree, sir?
Yes.
Okay. Now, all those great initiatives are part of CDC's Safe Motherhood program, which the Preventing Maternal Deaths Reauthorization Act reauthorized. So I have to ask you this. Are you aware, sir, that the fiscal year 2027 HHS budget, which you're testifying about here today, seeks the elimination, not the restructuring, not the relocation, but the elimination of CDC's Safe Motherhood program?
Can I reply to that?
Yeah, are you aware that you're seeking to eliminate that program?
Yes.
Okay. It's also my understanding that this administration is prioritizing, quote, family formation. Is that correct?
Prioritizing what?
Sorry?
I didn't hear what you said.
The administration is prioritizing, quote, family formation. Is that correct? That's the words of the agency.
Family formation?
Uh-huh.
I can tell you what we're doing on maternal health.
Well, so your agency says family formation is a priority. Wouldn't you say it should be a priority to make pregnancy and childbirth safer and improve outcomes for all moms and babies?
It is a priority, and we're doing more on that than any administration
Okay, so your
in
answer
history.
your answer is yes. Now, the fiscal year 2027 HHS budget also seeks to eliminate the Title X Family Planning Program. Title X provides more than 2 million low-income people access to critical services like contraceptive care, helping people have kids or not have kids as safely and on their own time. Contraceptive care, as defined in HHS's regulations, includes things like birth control pills, IUDs, implants, and condoms. Mr. Secretary, are you aware that 8 in 10 women of reproductive age have used some kind of contraception in the last year?
As I said...
No, are you aware that these people have used contraception in the last year? Yes or no?
This administration has done more for maternal health and to
Okay,
prevent...
are you aware that 8 in 10 women of reproductive age have used contraception in the last year? Yes or no?
As I said, we are doing more for maternal health.
Are you aware that nearly a third use it for medical purposes other than preventing pregnancy? Yes or no?
If you care about the outcome of maternal health, you should be supporting what we're doing.
Okay, so you don't know. Are you aware that every dollar invested in family planning saves the public over $7?
We had 42 maternal health programs at
So you don't know. So I want to ask you something right now, and this is really important. Will you commit right now before the American people that HHS, under your leadership, will not take any action that will limit people for the birth control method of their choice? Yes or no?
As I said, we have done more for maternal health than any administration in our history. We have one program, the perinatal pilot program, that has already dropped maternal health deaths by 42% in 220
Okay,
hospitals.
I only have 6 seconds left. let the record reflect the Secretary refuses to tell the American women whether he will let poor women use the contraception method of their choice. And let the record also reflect, it is 2026, Madam Chair. I yield back.
Gentlelady yields back, and I now recognize the chairman of the full committee, Representative